This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And at Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain. In today's episode,
is heart disease more common in men or women?
Bahrain is becoming a hotspot for heart disease.
So those are the two big chambers of the heart, and those are the two smaller. So if someone is having symptoms of chest pain, they should get medical help right away. This morning started out for Muhammad just like any other morning when he woke up from bed and went to exercise. However, something felt wrong then. He was starting to experience severe and crushing chest pain. The pain was so bad that he had to stop whatever he was doing and call for immediate help. Help was soon on their way, and Muhammad was brought in here to this hospital. I'm Dr. Khawla, and in this episode, we will follow the story of Muhammad and his journey towards hopeful recovery.
Hello, how are you doing? I am Dr. Abdulaziz, interventional cardiologist here. How is the pain now? Okay. So, Muhammad Siraj, what is happening is you're suffering from a heart attack, and the heart attack is caused by a block in the heart arteries. So what we'll be doing right now is we take you to the cath lab, we do an angiogram. Angiogram is where we can see where the blocks are, and we try to open the blocks and put in a stent, and you will be fine. There's nothing to worry. We will take care of you. You are in safe hands. Is that okay?
The doctors down at the emergency room ran a few tests. The tests confirmed the unfortunate diagnosis. Muhammad was suffering from a major heart attack at only 32 years of age. The doctors believed that the cause of his heart attack was a blockage to one of the arteries that supply the heart with its essential oxygen and nutrients. Right now, and just behind me, Muhammad is undergoing a major procedure called cardiac catheterization. The procedure is aimed at looking at the site of the blockage and aiming to open it. in order to save his life.
Already, blood pressure.
How did the procedure go?
Yes, the procedure went well. It took a little time because he had multiple blocks. And though he's a young chap, just 32 years old, he presented with an extensive heart attack, a massive heart attack. And we found 3 blocks in his arteries. One was 100% occlusion, the other one was about 80%, and the third one was about 90%. We dealt with all these arteries and we've opened up all the procedures. His pain is relieved completely now. He's stable. His blood pressure is okay now. It was lower on the it was low in the emergency. Now it's coming up. He's doing well. We'll shift him to the ICU now.
Do you mind showing us what you found
sure.
on the procedure?
So this is these are the angiographic images of this patient. Now this is the catheter that goes into the heart, and this is the artery that it engages. On the left side, normally there are 2 arteries. Now this is called the LCX artery, this is called the LAD artery.
So,
right?
so my understanding is this is like an X-ray but of the heart, right?
Yeah, it's a live X-ray, you can call it.
Live
X-ray, right?
Okay.
So what we see is this artery, it just comes here and then stops here. It should go all the way till here like this.
Oh wow, okay.
Yeah.
So everything that's in black means it's an artery,
yes.
and where I don't see the black going means there's a blockage.
There's a block. I'll show you another view. I'll keep it running so you can see. Now you see this artery, it's flowing down like this.
Yes.
Yes. But this artery gets stuck here. There's no flow beyond this.
Oh, okay. So it's like a road that just gets blocked.
Yes. So it's there's a clot there, there's a thrombus there, so it doesn't allow the blood to flow in. And the dye that we inject in doesn't go distally.
Okay.
So, and the other artery also is not normal, if you can see this. Here you can see this is the normal size of the artery, this is the normal size of the artery. This segment is pinched. So yes, so this is also a tight block. These are the arteries on the left side. On the right side also here a critical block. Now this is the right artery, the right coronary artery. You can see it's a big artery. This is the normal size of the artery. Here is the normal size. In between you see it is pinched.
Yes.
There's a focal block here. This is again about 80 to 90% here. So we fixed all these and I'll show you how we've done that. This is the special catheter that sets in. So this is used to deliver the wire, the balloon, the stents into the coronary arteries.
So that's how we get into the heart vessels.
So yes, so this is going from the radial artery, from the hand, through the arm, into the heart. And this is engaged there. And then this provides support for us to send the remaining material in. Now this was a slightly difficult case because he had come a little late, and so the clot was very thick. Okay. Now this is another angle of that. What we see here is, now this the artery should come down here like this.
Yes.
This is the major artery of the heart. The LAD is the major artery of the heart. It supplies almost 50% to 60% of the heart supply. So now what we've done is we've passed a small wire into the artery.
Yes.
The wire is very tiny. It's 0.14 inches. So that's a very tiny wire. We try to pass in the wire, and yeah, now the wire is through. This is the wire, and once the wire is through, you can see some trickle of blood here. Okay, so what we do next is we take a balloon, a small balloon, just about 2.5 millimeter balloon. We take it in, we try to dislodge the clot with it. We did that multiple times, but still the flow is not established. The flow is still not there.
Is this usual?
No, this is not usual. If the patient comes to us early, say within half an hour, 1 hour, it's very easy to open. Now this patient came a little late, so the clot is very organized.
That's why if someone is having symptoms of chest pain, they should get medical help right away.
So the sooner the patient can come, the easier it is to do the procedure, and the better are the outcomes. Alright, so what we did is we took in a special catheter. I'll show you that. Now you see this thing coming down. This is a special catheter that goes all the way into the artery, and then we aspirate it, so it sucks out the clot from the artery.
So instead of getting something in and trying to widening it,
Yes.
instead you're trying to
Yes,
suck
we're
the
aspirating.
clot
This is
out.
called a thrombus aspiration catheter. So we have sucked out the blood clots from this, and after that you will see better flow now.
I guess people are wondering, why would such a young patient get such extensive heart disease?
Yes, we worked him up extensively. We investigated to see what is the cause of this. This gentleman doesn't have diabetes, doesn't have hypertension, doesn't have a family history, doesn't even smoke. But then we found him to have hyperlipidemia, which is an abnormality in the cholesterol level. So that could be one of the risk factors. And plus, being Asian, being an Asian male, also is a risk factor. So these are the two risk factors. He never had any symptom. This was a sudden onset. But whatever said and done, all his lesions have been addressed, and he's doing well. But yes, he needs to continue his medicines and lifestyle measures for a long time.
Thank you, Dr. Aziz. Thanks for having us today, and I'll come and see you again in a few days with Mr.
Thank you.
Muhammad. Did you know that heart disease is the #1 cause of death around the world? It claims over 17 million lives every year. I mean, just imagine. Now, some of you might be wondering, is heart disease more common in men or women? The answer is not quite simple. While men get heart disease at a younger age, women's risk for heart disease goes significantly up after menopause. What about younger adults? Do young people get heart disease? And the answer is yes. There are certain groups of young people who do get heart problems. Those include people with high cholesterol or even genetic predisposition to getting heart disease. What about families? Does heart disease run in families? And the answer is yes, absolutely. To find out more about heart disease, I'm going to go upstairs right now and meet with Dr. Abdul Aziz. How are you, Dr. Abdul Aziz?
I'm good. Please have a seat.
Thank you, thank you. Good to see you again.
Yes, same here.
Tell us how Mr. Muhammad is doing.
Mr. Muhammad is doing extremely well. He has not had any recurrence of chest pain in the last 48 hours. He's maintaining his blood pressure very well now. He's been mobilized within the ICU. We're making him walk within the ICU. His ECG is stable. Echo we have repeated. The ejection fraction has improved from 25 to 45%, which is very good for him. And I think he's all ready to get discharged in a day or so.
That's good to know, very
Right.
good to know. Now, getting him ready for discharge, what are some of the important things that he has to do at home in terms of diet or exercise to prevent this from happening again?
That's a very nice question. So one of the most important things is for the patients to take rest right now, because he has had a massive heart attack. It's going to take some time for the heart to heal. So I would recommend rest for about 4 weeks, and then afterwards slowly increase his activities, and then he gets back to normal activities in probably about 8 weeks from now. Secondly, it's very, very important that he takes his medication regularly. The blood thinners, aspirin, and there's another one that I'm giving, ticagrelor. These blood thinners need to be taken very regularly for at least 1 year, and after 1 year we'll put him on just aspirin. Also important is changes in the diet. Yes, so now this patient has hyperlipidemia, so he needs to control his diet, take a low fat, low cholesterol diet.
And by hyperlipidemia, you mean elevated cholesterol
Yes, his
levels?
cholesterol levels are high, so he needs to take care of that. And so for that, diet is a very, very important part. So he should avoid all sorts of red meat, all right, avoid heavy oily items, all things containing heavy fats, all right, and need to focus more on a Mediterranean sort of diet, we call it.
Okay.
So this consists of more of fruits and vegetables, more of salads, fruits, all olives. These things are beneficial for the heart.
What other, medical problems other than high cholesterol that put someone at high risk for getting a
Yes.
heart?
So we call these as risk factors. So people who have diabetes, they're very prone to have heart attacks. People who have hypertension, they're very prone to have heart attacks. People who smoke regularly, active smokers, they have. And then plus people who have a family history. Somebody in the family, the parents or siblings, if they have had a heart attack, particularly at a younger age, the risk of having a heart attack in that person goes up. So these people need to be extra cautious.
Thank you for having us today, Dr. Abdulaziz. And do you mind if we go and see his heart function? On
Yes,
the
sure. We can have a look at his echo and see how he's recovering. Yes.
Very good. Thank you.
All right. How are you doing, Siraj, today?
Good, sir.
Okay. So we will be doing an echo today to see how the heart pumping has improved. Okay. Just turn to the left, please. All right. So this is his heart that we are seeing as an echo. And we see that the heart pumping has improved quite nicely. I'll show you in a good view. Yes. Now here you see the entire part of the heart is moving, contracting nicely. So this heart pumping, when he came in at the emergency, was only 25%. Now it has improved to almost 45%. So which is good.
So the 45% is the amount of blood or the percentage of blood that gets ejected from the heart?
Yes, the volume of blood that is being ejected from the heart.
And normally, what do
The
you
normal is
expect
around
it?
55 to 60%.
Okay.
So he is definitely improving. From 25 to 45 is a big improvement, and inshallah he'll improve further. Right. I'll show you another view here. Yeah, so this is the other view of the heart. Now this is called as a 4-chamber view. You see the left side of the heart, the left ventricle, left atrium, right ventricle, and we see the contraction of the left ventricle. It's coming in nicely, except for probably this part of the heart, which will take some more time to begin contracting.
So those are the two big chambers of the heart, and those
Yes,
are the two
yes,
smaller
the smaller
ones,
chambers.
Right? And his
And
heart
these
attack.
are the valves between this.
Yeah.
His heart attack was in this area,
Uh-huh.
in this
So
area,
the
this
big
entire area,
chamber-
in the big chamber, and this entire area was affected. Now you can see good movement in that area.
And these are sort of the gates, right, from the
These
small
are,
chambers.
these are the valves which allow blood to flow from the small chamber into the big chamber.
And those are working fine.
These are working fine, yes. No
Good to
problem
know.
there. So alhamdulillah, this is improving very well. Inshallah, we'll do well.
Hello friends, my name is Dr. Prashant and today I'm going to give you some healthy tips and how to prevent heart disease in future. So first of all, talking about heart disease, as we know that it's a menace in all over the world, in the society, and we can prevent heart disease by doing regular exercises, by eating more vegetarian food, and preventing any uncomplicated heart disease like heart attacks, chest pains, and we also advise our patients to do regular exercises every day, minimum 20 minutes if possible, and maximum 60 to 75 minutes. And in future, if suppose we get a heart attack, then how do we prevent future episodes? That is by regularly following with your doctors and religiously taking your medicines and doing healthy workouts like walking and eating healthy vegetarian food. Thank you very much.
So how are you feeling? Good? About your any pain or anything? No, everything is fine. So we'll do some exercises for physiotherapy. I'm a physiotherapist. My name is Vinay. Okay. So I will make you a little up. Is it fine? Okay. So can you hold my hands? No pain, nothing, right? All strong, right? Yeah, just lift it up. Up your hands, up your hands. Yes, very good. This one. Yes, any stress on your chest? No, everything is fine. So now we will do some breathing exercises. Okay? Just open your hand, like take deep breath. When you open your hands, take deep breath inside, then close it out. Okay? Or take breath with your mouth, nose, and release with your mouth. Yeah, this is to increase your blood circulation and your chest expansion. Okay, just relax. The same thing you need to do when lifting your hands up. Take up, open your mouth and release the exhale by your mouth. Okay, that means release it from your mouth. Yeah, lift it up. Yes, lift it up. Very good. Slowing down, relax, just relax. Very good, relax. Yes, just relax.
So Bahrain Specialist Hospital, they send me the ambulance and we are going there. We are meet there Dr. Abdulaziz. He checked me and he told me, Muhammad, you have a blockage in your arteries, so we do the angiography or angioplasty. And that time I'm very afraid because I don't have any bad habits and I don't have any past disease, and suddenly I have a heart attack, so I'm very worried about that. But Dr. Aziz told me, don't worry about it, I will do the angiography and angioplasty. After that, you very well soon.
I joined here last October as an interventional cardiologist, and we started this cath lab in the month of December. And by God's grace, we've done over 100 successful procedures so far. Bahrain is becoming a hotspot for heart disease. As per one statistic, I think about 16% of the deaths in Bahrain are because of cardiovascular disease, so which is a significant number, which means 1 in every 5 patients is dying from heart disease. My message is, listen to your symptoms, listen to your body. If you have any slightest suspicion that you might be having a heart problem, get yourselves evaluated. Do not delay, go to the nearest clinic and get yourselves evaluated.
This is the good chance for me to say thank you Dr. Mr. Abdul Aziz and his team, because they are done a great job for me. Also my roommates, my friends and my colleagues, they are also doing the good job for me, and I'm very well, and I started also the job, so now I'm very comfortable, like feel like same like before.
Today we witnessed the story of a heart attack, one of many in the life of a cardiologist. I'm Dr. Khawla, and I'll see you next week with a brand new episode. Stay safe.